What's itching you? Not figuratively, literally. Does your skin feel itchy? Do you have a rash or no rash along with that itch? That's a good question. Here to answer some of our skin mysteries and tell us whether we should dig deeper so we can scratch less is Bay Dermatology and Cosmetic Surgery physician, Dr. Summer Moon. Thanks for being here, Dr. Moon.
Thanks for having me.
Now, I was just learning about something called pruritus. What is that what causes an itch? What is pruritus?
Pruritus is just itchy skin. So people come in all the time and they say, my skin is itchy, and my scalp is itchy, and we don't know what's causing it. So itching can be all throughout the body, or it can be in one particular area. So itching has many signs and many reasons behind it. We've talked before about the eczema or the psoriasis or the seborrheic dermatitis, but there's also things that really don't cause a rash or may not cause a rash initially. We're talking about bites and mites and nerve-related things, even things like shingles or things going on internally in our blood, like if we have thyroid condition, anemia, liver issues, kidney issues. So there's lots of reasons to itch.
There's so many different reasons, and it's hard to say, okay, what is causing this? The next question for me is, when do you want to call a doctor? At what point are you like, okay, I'm just going to let this, maybe take a Benadryl. You don't know what it is, but you need to call a physician at some point to identify that if it continues?
Absolutely, yeah. So typically if you're using your gentle cleansers and soaps and moisturizing and you're replacing your moisture daily and you're still having this itch, I think it's a really important time to come in. We do a thorough history, dive deep down into what you're taking. This could be something internally that you're taking, a supplement, something putting on your skin, or labs that need to be checked. And we check you from head to toe. We're looking for anything. Fungus can make you itch, nerves can make you itch, nerve impingements or even shingles. So there's lots of reasons why to come in. So I would specifically say that if your itch is not going away with normal moisturization measures, come on in so we can help you.
And what happens when a patient goes in and you look at it? So you've seen all kinds of different itches, but what kinds of things do you look at? You look at blanching. What do you identify, help you use to identify what could be causing that?
Yeah, so one tool that we use is something called dermatographism. So we kind of take your skin and we kind of like mark on it and we see if you're hiving. If you're hiving to something, then we know something either systemically or maybe it's a bug bite. You have elevated histamine. So we do a lot of things with your skin to kind of help trigger us into what could be causing your itch. We look at your scalp. Is it brittle? Is it breaking off? Is it a thyroid condition? Is there scaling in between your toes? Is there fungus? Do you have, quite a bit of scale all over your skin? So it's really kind of a big head-to-toe evaluation. Medications, even labs, of course, like we mentioned, and even nerves. I compare one side of the arm to the other side. Say, does this feel different? And we can kind of narrow in on what could be driving your itch.
And once you identify that, so many different options for treatments and medication, whether it's oral or topical.
Exactly, yeah. So typically if it's a drug, we're going to recommend you avoid that, go on like a drug holiday. If it's something topical, we're going to ask you to avoid that. And then if it's nerve related, there's lots of really great options that are coming out right now. These particular biologics that can actually help you with the nerve inflammation on your skin as well as target the inflammatory itch scratch cycle. And of course antihistamines and oral prednisone and topical steroids as needed.
Great stuff, doctor. We appreciate all that very helpful information. And we want to let our viewers know, there you go, Bay Dermatology. You can call 727-585-8591 and voted by Tampa Bay as the #1 dermatologist. Congratulations. Thank you so much for your time today.
Thanks for having me. Everyone's grateful.